Did you know that 1 in every 50 people have a spinal cord injury? Over 11,000 injuries happen a year that are spinal cord injuries, and the percentage of people that regain the ability to walk is very small. It's not actually the injury itself, but the treatment or lack thereof. What most people don't know is that there are several different methods and procedures that medical scientists have discovered that can help regenerate the spinal cord and regain some function. As someone with a family member that has a spinal cord injury, this information is very important to me and my family. Today I'm going to tell you about a few of the different procedures, both surgical and non-surgical, that medical scientists have discovered to help spinal cord injuries. The most common non-surgical method is known as the exercise-based recovery. The exercise-based programs focus on the Darzinski method, which targets the individual's weaknesses and uses them to retrain the nervous system to respond appropriately. The exercise-based treatment increases their muscle mass, decreases muscle spasms, and stimulates the nervous system. Whenever a patient decreases his or her pain medicine and replaces it with the exercise program, it can be used to, the nervous system uses the spasms to coordinate the function of the muscles and also decrease pain. A very popular actor used a program like this to help with his spinal cord injury. Christopher Reeves, who is also known for playing the fictional character Superman, sustained a spinal cord injury, leaving him completely paralyzed. But after going through the exercise-based program, he was able to regain some movement and function, and was shown walking on a treadmill just a few years before he died. Over 90% of Project Walk's clients have regained function beyond their injury level, and that's a high success rate for this kind of program. So it's a promising method that spinal cord injury patients can use to regenerate function without having to have surgery. Now that we've discussed the most popular non-surgical method for treating spinal cord injuries, let's discuss the two methods that medical scientists have discovered that are surgical that can help regenerate the spinal cord. First, there's the surgery that involves the Schwann cells. Schwann cells are cells that cover any nerve fiber in the peripheral nervous system, and that forms the myelin sheath in your body. They can be used to regenerate new cells, so they would be useful in repairing the spinal cord. Scientists have performed the Schwann cell transplant on rats with some regeneration success. So the FDA has approved the United States to perform clinical trials on humans. To have the surgery done, the doctors harvest the Schwann cells from the patient, which could be from the leg, the ankle, or anywhere they find useful to harvest the cells, and transplant them onto the spinal cord injury site to help repair and promote, function and promote regeneration. The surgery isn't fully cleared to be done in the United States, but the people that have had the surgery done has had some promising regeneration and function. The other surgery that they perform is also the stem cell surgery. It's kind of like the Schwann cells, but they're found in tissue or organs that can renew or repair the tissue in which it's found. The FDA hasn't approved the surgery to be done in the United States, but other countries are performing it. Stem cells are showing a high success rate of partial regeneration in rats that have had their spinal column completely severed. Stem cells can be harvested from tissue, organs, bone marrow, embryos, and blood. After having the stem cells harvested, they insert the cells above and below the spinal cord injury site, where regeneration can hopefully be seen. While each patient's conditions are different, the majority of the people that have had the surgery done have noted significant improvement in function and senses. Today I have discussed some of the most popular surgical and non-surgical methods that medical scientists have discovered that can be used to regenerate and repair the spinal cord. The science and research on spinal cord injuries is always growing, and hopefully they can discover a treatment where there's a 100% success rate. But until then, the world has seen quite a bit of success with all the methods I've explained to you. Hopefully this information could be of some good use to you. Maybe you know a family member or a friend that has a spinal cord injury that can really use this information so they can find out different ways to heal their injury and possibly regain some function.